Hi, I'm Gabriel Martz, and I'm the director of the Epilepsy Center at the Hartford Healthcare Higher Neuroscience Institute. I specialize in the care of people with epilepsy and seizures. When I meet a patient, my primary goal is just to figure out what are their goals. I want to learn about how they want to live their life, what's limiting them living their life, and obviously my main focus is on seizures and how that's impacting them, but there's lots of other factors that come along with seizures. It can be depression, it can be anxiety, it can be we know that people have trouble getting through college or getting married or driving when they have seizures. So we want to learn all these challenges, figure out what's driving someone to live their best life, and just help them get there. We are fortunate to have built a very strong comprehensive care program here at Hartford Healthcare. We have clinics in a variety of locations, and that's where we meet the people and start introducing them to the care we can provide. We start with medicines. Medicines work in about 2/3 of people with epilepsy. It takes a process to figure out which medicines will work best for them, what side effects we can avoid, what doses they need. We have a huge range of diagnostic testing through imaging modalities like MRI and PET scans. We have all variations of EEGs, including intracranial EEG, where the electrodes actually go inside the brain. Sometimes we'll even implant a kind of like a pacemaker for the brain or a defibrillator for the brain that watches when the seizures are going to start and tries to stop them just as they do. So we've had patients who we've cured of epilepsy, but they're so anxious that they might have a seizure that they're really limiting their own lives. So a lot of what we're dealing with is behavioral health, coping strategies, and just listening to the specifics of someone's life so we can help them walk through whatever doors they feel are closed. Referring providers should know that as soon as a patient walks through our door, we're going to do everything we can to help them, and that includes partnering with whichever other doctors are part of their care team. Outside of medicine, a real common theme for me is people. I see my family whenever I can, and I have a large group of friends from high school, from college. We stay in touch. We play fantasy football together. That's where I spend my vacations, is with my friends. That's the driver.